hotspots growing. Texas and Connecticut both seeing increases of 1,000 cases in just one day. While New York State suffering its deadliest day yet, nearly 800 fatalities in 24 hours.
The bad news isn't just bad. The bad news is actually terrible.
The state now with more cases than any country outside the U.S. As we once again take you to the front lines.
You're going to be sad, and you're going to be mentally and physically strained.
And news this morning that social distancing may already be paying off. The dramatic new prediction that offers real signs of hope. White House Task Force member Dr. Anthony Fauci joins us this morning.
Unemployment nightmare. Millions struggle to get benefits, desperation setting in as crowds seek applications. The number of jobless spikes nationwide. New numbers this morning.
COVID-19 confrontation.
Hello. Where are you from?
The suspicious pop-up testing site driven out by angry residents. The red flags. The operation under investigation this morning.
White House showdown. Joe Biden set for the Democratic nomination after Bernie Sanders drops out of the race. How the coronavirus crisis is reshaping the race for president.
Severe weather strike. Overnight, tornadoes touching down in Arkansas, damaging homes and cars, and powerful winds flipping a semi-truck off the road in Illinois. We're tracking the latest this morning.
And Day of Hope. We're celebrating Americans all across this great country, making a difference. With lines at drive-through food banks stretching for miles, the unsung heroes racing to help hungry families in need, putting their own lives at risk. Plus, the stars giving back, from Russell Wilson and Sierra to J.J. Watt.
I think one of the most beautiful things about this country is when people come together during difficult times to help each other out.
This morning, what you can do if you need help or can give it.
Live in Times Square, this is Good Morning America.
Good morning, America. We are looking forward to our Day of Hope, something we could all use a little more of right now. And this morning, we're partnering with Feeding America, and we're shining a very deservedly bright light on those brave volunteers. And Robin, we see these images, extraordinary images of those long lines.
Yes, we do, my friend. Hundreds and hundreds of cars lining up in Pennsylvania. And people are counting on those volunteers that you speak of to help them put food on the table right now. This morning, we're going to tell you how you can help. Now, another thing so many of us could use right now, and that is a hug. So take a look at this image. A mother wrapping her daughter, who is a nurse, wrapping her daughter in a clean sheet before hugging her. We're going to hear from them in just a few moments. I'm sure both of them needed that hug, George.
Boy, they sure did. It was so good to see that as well, Robin. Good morning to you both. Here are the latest numbers we have right now this morning worldwide. The death toll is now nearing 90,000. Nearly 330,000 people have officially recovered from the virus. And here in the United States, more than 14,000 have died. More than 24,000 have recovered. And the newest guidelines from the CDC are going to be released. They're making it easier for essential employees that may have been exposed to COVID-19 to get back to work if they're not experiencing symptoms. And we're going to talk to Dr. Anthony Fauci of the White House Coronavirus Task Force in just a couple of minutes.
Looking forward to hearing what he has to say this morning, George. But we're going to begin with the hard-hit state of New York. Whit Johnson starts us off this morning inside New York's St. John the Divine, now being used as a field hospital. Good morning, Whit.
Robin, good morning to you. Instead of Holy Week preparations, this historic church is now preparing for the possibility of seeing COVID patients by Easter. You can see the decorations that are already up here, that hospital tent now behind me. They plan to set up at least 50 hospital beds. That number could expand to 200 if needed. Now, there are signs that New York State could be approaching its peak, but it comes with a painful toll.
This morning, New York State reeling from its deadliest day in the pandemic. Nearly 800 fatalities in just 24 hours. The statewide death toll now more than double the lives lost in 9/11. The mood is heavy inside this makeshift ICU in Maimonides Hospital in Brooklyn.
You are going to be sad, and you're going to be mentally and physically strained.
Anesthesiologist Daniel Nicola on the phone informing someone their loved one is not doing well, tearing off his mask, head in his hands, needing a moment away from the mayhem and sadness.
Honestly, it's one of the more psychologically exhausting parts of the job. Telling someone that their family member may not make it, it really does, it takes a lot.
New York officials worried the number of deaths from COVID-19 could actually be much higher because some who die at home with coronavirus-like symptoms haven't been included in the count. Most of the data coming from hospitals and nursing homes.
We do want to know the truth about what happened in every death at home.
This morning, some encouraging news from New York Presbyterian, reporting for the first time since the outbreak, they had more people go home than were admitted into the hospital. Governor Cuomo cautiously optimistic, but urging New Yorkers to continue to follow social distancing guidelines.
If we stop what we are doing, you will see that curve change.
Other hotspots still growing in places like Washington, D.C., Baltimore, Louisiana, Chicago, Detroit, Pennsylvania, and Florida. And it's not just populated cities. This map, published by the New York Times, showing more than 2/3 of rural counties nationwide have at least one confirmed case. But amid the despair, stories of hope and inspiration. Bronx Assemblywoman Carinas Reyes left her job as a nurse when she took office last year, but didn't hesitate to jump back into her scrubs to answer the call.
Before I was an elected official, this has always been my passion, and I think it would have been selfish of me to stay home knowing that my community needed the very specific set of skills that I have.
And this photo, Cheryl Norton, fiercely embracing her daughter Kelsey Kerr, an ICU nurse in Cincinnati.
I just thought there's got to be a way I can hug her. And so I was walking past my laundry basket and I saw my big sheet and I was like, I'm just going to throw this over her. And she got out of her car and she had a mask on. And I just said, I just have to hug you. So I threw it over her and hugged her.
It was just incredible just to feel more normal again, because we're always been huggers, and it's just been very strange to conscientiously not, and to just feel together again in a small moment of normalcy.
The New York Times is reporting that new research indicates COVID-19 was likely brought here by travelers from Europe, not from Asia, and that it was probably spreading in this area by mid-February. That's weeks before the first case was confirmed. George?
Okay, Whit, thanks. We are now joined by Dr. Anthony Fauci. Dr. Fauci, thank you for joining us this morning. I want to begin with that new research showing that the COVID-19 may have been circulating in New York far earlier than people thought, mid-February, and that most of the cases came from Europe. What's your assessment of those studies?
Well, I think that's probably correct, George, because, you know, when you had the situation that Europe became the epicenter pretty quickly after China really exploded with their cases. As you know, we cut off the travel from China relatively early, and we were seeded with a relatively few number of cases from China. But very quickly, the epicenter switched to Europe, particularly northern Italy. And given the travel and the air traffic from anywhere in Italy, but also particularly northern Italy, it's just not surprising that, unfortunately and inadvertently, New York was seeded before they really knew what was going on. And that's why they're in the difficult situation that they're in right now. A very unfortunate situation.
Boy, it sure is. And how about those new models now showing that the projected death tolls in the United States could be far lower than we previously thought, maybe about 60,000 rather than 90 or 100,000?
Yeah, that's obviously good news, George. You know, as I've always said, you give models to try and help you project, such as the need for beds, the needs for ventilators, et cetera. But the models are only as good as the assumptions that you put into the model. And one of the assumptions was, I believe, that there'd be a certain degree of efficacy of the mitigation, the kinds of things we're doing right now, that New York is doing intensively. And so when you get new data, the data always trumps the model. So you have to take your data and then refashion the model. And that's what's happened. We've gone from 100,000 to 200,000 down to about 60. That's the good news. What we need to do is to make sure we don't let up on those mitigation, those physical separation programs, because if we do, that can just bounce back again. So even though it's good news and encouraging, we got to make sure, as I always say, we keep our foot on the accelerator when it comes to the mitigation.
So people who look at these numbers and say we're going to be relaxing the guidelines come May 1st with about 3 weeks to go, what's your message to them?
My message is that the virus itself is going to determine the guideline. We hope that by the time we get to this extended 30-day period, you know, we went from the 15 days of mitigation to the additional 30 days, which gets us to the end of April. I do hope by the time we get there that we will well see that curve that bending in the curve, which we've been talking about now for several weeks. There's some indication that that might be going on, particularly in New York. If you look at New York, as Governor Cuomo said very recently, the last few days have had a stabilization and a decrease in the hospitalizations, intensive care, and the need for intubation. You never want to claim victory prematurely. That would be not very good. But when you see those kind of trends, you hope that we'll see that curve go down, and then we could start to think about gradually getting back to some sort of steps towards normality.
Have we hit the peak in New York?
It's tough to tell, George. We very well may be there. You know, when you talk about peak, it goes up, it does this, and then it starts to come down. It's really looking like it's going to make that turn. But, you know, being very careful and cautiously optimistic, I wouldn't want to say that, but I think that is what is going on.
There had been some hope that early on that maybe the virus recedes with warmer, more humid weather. Where is the science on that now?
You know, you should not assume, George, that the virus is going to diminish because of the coming of the warm weather. It might diminish for other reasons. There's precedent with other infections, like influenza and some of the common, more benign coronaviruses, that when the weather gets warmer, that the virus goes down, its ability to replicate, to spread. It doesn't like warm, moist weather as much as it likes cold, dry weather. But having said that, one should not assume that we are going to be rescued by a change in the weather. You must assume that the virus will continue to do its thing. If we get some help from the weather, so be it, fine. But I don't think we need to assume that.
Finally, let's talk a little bit about the new normal after this crisis passed. Handshaking not going to be part of the new normal?
You know, I think at least for a while, George, as I've said, you know, people have kind of raised their eyebrows when I said it. I think we should refrain from that right now because we really need to concentrate on the physical separation, but also, even as you get back to normal, continue to wash your hands, because with viral diseases that are respiratory borne, where people continue to touch their face and then shake hands and touch doorknobs, to me, the better part of valor is just hold off on that for a while.
Dr. Fauci, thanks for your time this morning.
Always good to be with you, George.
Always such good information from Dr. Fauci. And Michael, I don't know about you, I'm willing to live with elbow bumps for a long time.
Yeah, I'm willing to just do it a wave, George, from 6 feet away for quite a while as well. But thank you. It was a great interview, by the way. And now, George, as we all know, the pandemic has had its effect on the economy. The number of unemployment claims across the country have been staggering. All eyes will be on the new numbers that are due out this morning. And Rebecca Jarvis has the latest.
This morning, a tidal wave of unemployment claims set to hit the American economy, with millions of people already out of work and desperate for relief. In Florida, hundreds of residents lining up in their cars to pick up applications, police directing traffic.
We've given out hundreds and hundreds of applications.
Just one day earlier at that same spot outside of Miami, chaos, as crowds of people ignored social distancing, pushing, shoving, and snatching forms, desperate to file.
Everybody out here is risking their lives to get this application.
Analysts estimating at least 5 million new unemployment claims over the last week, which could send claims skyrocketing to 15 million over the last 3 weeks.
I have not paid one bill since this all happened.
Cheryl Esposito of New York has been trying to file for weeks after the state's website repeatedly crashed.
I've calculated over 2,000 attempts to call. I'm worried about putting food in my mouth.
The financial crisis hitting home for small business owners, too. For days, California comic shop owner Joe Field has struggled to apply for a federal loan that would help pay his employees.
There's a lot of information here that I am not used to dealing with, even after having been in business for 32 years.
Small businesses make up 47% of employees in this country. The concern now, if the businesses don't survive, many Americans won't have jobs to return to.
It's hard to get the small businesses with enough financial flexibility to ramp back up when they want to and when they're ready to.
Treasury telling us those stimulus checks are on track for direct deposit beginning next week. And as for people struggling to file for unemployment insurance, the benefits do exist. Everyone who is eligible will get that money. George?
Okay, Rebecca, thanks very much. We're going to turn now to the race for the White House. The November lineup now set as Bernie Sanders has dropped out of the race. The Democratic contest, Joe Biden will be taking on Donald Trump in a race reshaped by the coronavirus crisis. Mary Bruce is tracking the latest.
This morning, Joe Biden is now the apparent Democratic nominee.
My good friend, and he is a friend, Bernie Sanders, announced he was suspending his campaign. He's inspired and energized millions of supporters, especially young voters, to join him in championing a progressive vision for our country.
Biden reaching out to Sanders' supporters after the Vermont senator called it quits on Wednesday, admitting victory was, quote, virtually impossible.
I cannot, in good conscience, continue to mount a campaign that cannot win and which would interfere with the important work required of all of us in this difficult hour.
But overnight, Sanders not yet ready to endorse his former rival.
I will say that we are, talking to Joe, and we're talking to his team about how we can work together.
The question now, what will the rest of this race look like? 16 states have postponed their primaries, many moving to expand mail-in ballots. The Democratic convention already pushed back to August, and Biden now says they may have to hold a virtual convention instead. Now, while Sanders has suspended his campaign, he does plan to remain on the ballot in states that still have primaries. And that means he can continue to gather delegates, and that could give him leverage as he now tries to influence the party's platform, George, especially on the issue of health care.
Yeah, that has been his signature issue. Okay, Mary, thanks very much. Robin?
Okay, George, now to something we simply cannot do enough right now, and it is so important to thank our healthcare workers there on the front lines. Take a look at this hero's welcome. A nurse had her camera rolling at the start of her day. First responders clapping, cheering, holding thoughtful messages to greet the medical team at North Shore University Hospital in New York. You're seeing this all around the country. It's this inspiration to take with them as they return to the front line. And Michael, as my mama used to say, you can't put a limit on gratitude. You cannot say thank you enough, right?
You cannot say thank you enough, and hopefully they really feel the love, Robin. And I love watching people do that. And every night at 7 o'clock here in the city, you hear people still screaming and hollering and banging on pots and pans to show everybody the gratitude they have for the great job that they're doing. And we're going to go to commercial right now, and I'm going to tell you what's coming up. Why some men of color say wearing a mask in public puts them at extra risk. And the intense confrontation that was caught on camera, a suspicious pop-up testing site driven out by angry residents. Was it legitimate? But first, we're going to go to Ginger at home. Good morning, Ginger.
Good morning, Michael. Another Arkansas tornado, this one at night in Harrisburg there. You can see about 30 homes were damaged. And we've got to get to the Chilly Cities, brought to you by Planet Fitness.
Since everyone's at home, binge button all, Planet Fitness is bringing the judgment-free zone to you. Join us on Facebook Live for daily home work-ins, like puppy playtime, homeschool recess, and race car cardio. Plus, we put our gym in your pocket with an app packed full of workouts for everyone and trainers you totally high-five, if you could. Ditch the binge butt and work in with us. Download our free app today. Planet Fitness. United we move.
It's another weather alert from Stormwatch 7, but not just for the morning hours, throughout the entire day today. We're tracking big changes. First, some morning storms. Those could bring some isolated damaging winds to the area. But even after that storm moves out, high winds today. Wind advisory, much of the area could see gusts of 50 miles per hour. Temperatures drop 71 by noon today. 35 is what it may feel like early tomorrow. It's going to be blustery. Sunshine back tomorrow through Saturday.